Health insurance is one of those big topics that's always asked about for 1099s and locums, for almost any profession, for those that are switching out of their W 2 jobs, because that's one of the benefits that is always hard to replace. And it's one of those kind of expensive benefits, that and disability insurance. And but first, there's the Locum Institute, and that's one of those things that I am passionate about, and I have been a teacher in. And that's a new course that we've developed for those that are going from W 2 to 1099. So if you kind of want everything from going W 2 to 1099, look up the locuminstitute.com and try and go through that. And that kind of goes from setting you up to leave your W 2 and start out as 1099. But health insurance itself is one of those things that you want to try and look at. You can start out with trying to continue your health insurance for up to 1 to 2 years when you leave your employer. You can start by asking them if you can continue your health insurance and how long you can continue that health insurance after you leave your employer. So talk to your HR or plan administrator and see how long you can continue that health insurance. It's continued by cobra, and that means you have to pay both the employer and employee portion of that health insurance, but that means you continue the same coverage that you currently have. And then after that, there are different types of plans. You can either go with the marketplace, and that may be beneficial to you if you have pre-existing conditions. The other type is to go out and find your own through maybe a broker. That may be through a company like Thrivent is a broker. Another broker is Farm Bureau. Farm Bureau is one that I have used. UMR is another one that I've used. And then I don't recommend the health shares now. I used Liberty. That was a big flop for me. Other people have had great success through MediShare and a couple of the other health sharing organizations. Just be careful because a health sharing organization is not necessarily insurance, and you have to be very careful with what you're getting. So make sure you research it very thoroughly and know what exactly you're getting as far as quote unquote insurance, because it's not exactly insurance. Otherwise, you should look at what other benefits there are, especially as we get a little bit older and when Medicare may be kicking in your Part A, B, and C. Make sure that you have signed up in time to where you're not going to get penalized for your prescription coverage and be paying more. So look at all of these things and make sure that you have discussed your options thoroughly. Also, if you're part of a professional organization like the AANA, they have a insurance portion, which is also a broker for health and disability insurance. If you have other questions, drop those comments down below. Make sure you like and subscribe.